Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com. Endstage COPD symptoms and prognosis. Endstage chronic obstructive pulmonary disease, COPD, refers to being in the final stages of the disease. At this stage, you can expect to experience significant shortness of breath even when resting. Because of the degree of lung damage at this stage, you are at high risk for lung infections and respiratory failure. /r/n/r/n You might associate the term end stage with imminent death or grave disability that's leading up to death. Certainly, there is a higher risk of death at this stage, but you can survive for years with end-stage COPD. /r/n/r/n This article defines end-stage COPD and explains how it is diagnosed. It presents treatment options commonly used in end-stage COPD and tips for coping with end-stage concerns. /r/n/r/n Illustration by Emily Roberts for Verywell Health /r/n/r/n With advanced COPD, you can have symptoms all the time or almost all the time. And the effects of your disease at the end stage will be so advanced that they will undeniably affect your day-to-day activities. /r/n/r/n Symptoms you can experience with end-stage COPD include, /r/n/r/n By definition, end-stage refers to the last phase in the course of a progressive disease. There are criteria that help define this stage. /r/n/r/n According to the Global Initiative for Obstructive Lung Disease, GOLD, there are 4 stages of COPD, /r/n/r/n Each stage is defined according to the spirometry measurement of FEVthe, the volume of air breathed out in the first second after a forced exhalation. Endstage COPDis is considered stage 4, or very severe COPD with an FEVthe of less than or equal to 30%. /r/n/r/n The Global Initiative for Obstructive Lung Disease, GOLD, defines 4 stages of COPD, with stage 4 as its end stage. It was updated in 2017. Other systems to evaluate COPD include :r/n/r/n 12-year study of 490 people in Sweden, published in 2021, looked at these methods and found the ADU and the lung function assessments were most accurate in predicting life expectancy and mortality. /r/n/r/n Research suggests that people diagnosed with COPD lose an average of 6 years in life expectancy when compared with their counterparts who don't have COPD. But other conditions, such as heart disease, actually accounted for 2/3 of these deaths. /r/n/r/n The individual prognosis for someone with end-stage COPD will depend on a number of factors that influence COPD life expectancy. They include, /r/n/r/n Some people in end-stage COPD are still able to function reasonably well with few limitations. On the other hand, there are also many people at this stage who are very sick. You also can develop complications of lung disease that include, /r/n/r/n With end-stage COPD, you are likely to have limitations in your activity levels, which leads to a risk of blood clots, obesity, and pressure sores. /r/n/r/n Often, treatment options haven't been exhausted when diagnosed with end-stage COPD. There may be aspects of your health that can be managed to help make you feel more comfortable and to avoid complications of your pulmonary condition. /r/n/r/n For example, you are likely to have low oxygen saturation levels, needed oxygen in your blood, and you will probably be prescribed supplemental oxygen. If you take a break from your oxygen supplementation, you may notice your symptoms worsening. /r/n/r/n As the severity of your disease advances, the focus of your treatment may begin to shift to palliative care to relieve your COPD symptoms. /r/n/r/n if you're facing a diagnosis of end-stage COPD, your healthcare provider may prescribe the following treatments. /r/n/r/n Pulmonary rehabilitation has been found to be beneficial for people with COPD at all stages of the disease. A 2017 study found that for people with severe COPD, pulmonary rehabilitation improved symptoms for 92% of the participants and resulted in 54% fewer days of hospitalization. /r/n/r/n Nutrition counseling can help with malnutrition, a common complication in end-stage COPD that increases the risk of death. A counselor who specializes in caring for people with COPD can also help with tips that make eating easier and more enjoyable amidst shortness of breath. /r/n/r/n American Thoracic Society guidelines recommend that people with moderate or severe COPD who experience shortness of breath and/or exercise intolerance receive a combination of two different types of long-acting bronchodilators rather than a single long-acting bronchodilator alone. /r/n/r/n This includes a long-acting beta agonist, LABA, medication as well as a long-acting anticholinergic/muscarinic antagonist, LAMA. Some combination inhalers include both of these categories of medication in a single inhaler. Short-acting bronchodilators may also be used for symptoms. /r/n/r/n Glucocorticoids, steroids, may be used either via inhalation, or in an oral or intravenous form, and guidelines for their use have recently changed. /r/n/r/n Oral glucocorticoids, such as prednisone, were once widely prescribed but should, in general, be avoided on a continual basis. They may still be needed for exacerbations or during hospitalizations. These medications were not found to affect shortness of breath, the risk of exacerbations, or survival, but did lead to a number of side effects such as high blood pressure and infection. /r/n/r/n Inhaled glucocorticoids may or may not be recommended. While they reduce the risk of exacerbations, they also increase the risk a person will develop pneumonia. They are likely helpful for people who also have asthma or who have one or more COPD exacerbations each year. /r/n/r/n Oxygen reduces breathlessness caused by activity and at rest. Not only can this improve symptoms, but oxygen may allow some people to engage in other activities, such as rehabilitation and physical activity, that improve quality of life as well. /r/n/r/n In the past, opiates were often avoided as some studies showed they may have serious side effects and may not benefit everyone. The latest guidelines, however, encourage the use of opiate medications for people who continue to have significant shortness of breath despite maximizing other therapies. /r/n/r/n This recommendation came about due to studies showing these medications were beneficial in improving quality of life, while not leading to an increased risk of falls/accidents or overdoses. /r/n/r/n Non-invasive ventilation may lessen carbon dioxide retention and improve shortness of breath, but it's not routinely recommended. /r/n/r/n Various surgical procedures may be needed in treating end-stage COPD in some people. These procedures can include /r/n/r/n lung transplant. Ineligible candidates with severe COPD also may be a surgical treatment option. /r/n/r/n Complementary and alternative therapy such as relaxation and visualization techniques, therapeutic massage, and music therapy with live instruments or recorded music can help soothe symptoms like shortness of breath. /r/n/r/n Living with end-stage COPD can make you feel scared and isolated. Getting psychological and social support is an important aspect of coping with the condition. /r/n/r/n Even when you have already developed very advanced COPD, there are several lifestyle changes that you can incorporate to have the best outcome possible. /r/n/r/n If your healthcare providers have discussed the chance that death is approaching due to your COPD, it's time to consider how you will manage end-of-life issues. /r/n/r/n whether you or a loved one is taking charge of the decisions at this point. Deciding how you will seek help during the end-of-life stage can make the process a bit easier for everyone involved. For example, you and your family may want to consider enlisting the help of hospice to guide you through this time. /r/n/r/n when you have been diagnosed with late-stage COPD, talk to your healthcare team and loved ones about your values and beliefs to help ensure that any end-of-life care is consistent with your wishes. For resources to help with planning end-of-life care, visit the National Healthcare Decisions Day website. /r/n/r/n Advanced directives are documents that allow you to explain your wishes regarding end-of-life care. Your loved ones will then know what you want in terms of issues like resuscitation, feeding tubes, and ventilator support if you are unable to express your wishes at a later time. /r/n/r/n Symptom management is one of the most important aspects of end-of-life care because COPD symptoms often worsen in the final days, most notably dyspnea and cough, pain, anxiety and depression, confusion, anorexia, and muscle wasting known as cachexia. /r/n/r/n The end of life is a time of sadness and deep reflection for you and your loved ones. Remember that simple gestures like holding your loved one's hand and being present can provide immense comfort. /r/n/r/n Endstage COPD is diagnosed by a healthcare provider who evaluates your lung function. Symptoms usually include increasing shortness of breath, fatigue and difficulty with mobility, trouble sleeping, and chronic cough. /r/n/r/n While COPD is a progressive disease, there are a number of treatments available to keep you as healthy as possible for as long as possible. Lifestyle changes, including exercise and smoking cessation, also will help as you work with your care team to develop a treatment plan. /r/n/r/n On average, a person with COPD will lose 6 years of life expectancy but may have many years yet to live. Your prognosis will depend on many factors and there is no way to predict exactly how long you will live. Be sure to make decisions about your health and treatment options with your providers to ensure your best quality of life. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.